Hi, welcome to Straight Talk. Our goal here is to educate you about the opiate epidemic and drug abuse in general so that you can use it to help somebody that you care about or even yourself if you need it. And joining me on the show is Kabir Singh, who is the Chief Operating Officer for the Mid-Atlantic of Amatus Health, who's joining us to talk about the work that he's doing. Kabir, welcome.
Thank you, Mike. Thank you for
Appreciate you being here.
Honored to be here with you.
Any level of addiction, it destroys a family.
Destroys.
It's amazing.
Yeah.
Talk about that a little bit.
Yeah, the ripple effect of what happens, even families and friends, Mike, after overdoses. I mean, let's talk about the fatalities. The fatalities are at numbering in near, I think the last count was 191 a day.
Yeah.
And it keeps going up. You know, what happens, the fallout for that? You have children that are left behind without parents. You got parents that are left without, that are bearing children in the reverse order. It's not supposed to happen that way. And it's happening at an astounding rate.
Tell me about Amatus and what you guys are doing and where you're located. You're all over the place.
Yeah, so Amatus Health overall, we have 10 treatment centers in 4 states. There's 1 in New Hampshire. There's 3 in Maryland, 4 in Ohio, and 2 in Atlanta, Georgia. Really proud of opening up our most recent location, the 10th one, which is going to be in Hagerstown, Maryland. And that's going to be a 3.5 actually state Medicaid facility. And we're especially proud of that.
But here you guys are reaching out to a vulnerable population.
Yeah.
That people, when you think of a private treatment center, you think, oh, God, it's going to cost me a fortune. I can't afford it, so I can't get help.
Right.
And that's not your philosophy at Amatus.
No, we're trying to break down those barriers, those walls, make treatment accessible to all those who need it. A lot of times they're just calls that family members are making to us, trying to sort out the ins and outs of treatment. There's all sorts of horror stories surrounding treatment centers, and we're trying to identify ourselves as those who have moved above and beyond all that noise and are offering quality treatment throughout our centers. And we have at Amatus Health here just in our backyard, Knowings Mills, we are the backbone to all those 10 treatment centers. We offer all the compliance. We do the billing for them. The HR is really important for us to offer that support to our internal staff because it's taxing work. So prior to working at Amatus Health, I worked at an organization in Montgomery County called Cornerstone Montgomery. They serve the more severe and persistent mentally ill. And so I worked on an ACT team, assertive community treatment team. And on that team, there's a psychiatrist, there's a certified peer recovery specialist, there's a social worker, you could be a nutritionist, a variety of different things that make up that wraparound service. And we go and seek out the most vulnerable. So it was not uncommon for me to go out and meet someone in a tent to make sure that they're taking their medications and stuff like that. And I was usually the most relatable. It was easy to relate. I am a certified peer recovery specialist at CPRS in the state of Maryland. There are probably about 150 of us throughout the state. I have been one since 2014. So in 2013, the state started to offer that credentialing. It was already being offered in other states. It's starting to become recognized as another kind of spoke in the wheel for treatment. Kind of takes one to know one type of thing. So I'm a recipient of treatment services myself. So I know what it's like, and I've been through that process. So becoming a certified peer recovery specialist in the state of Maryland is a variety of things, 500 hours in the field, some supervision, some class hours and things like that, and then a state exam. So of those about 150 certified peer recovery specialists, most of them are within the limits of Baltimore County and the city. They're mostly located here. That particular council, which I sit on, is made up of community stakeholders.
Now, let's go over these players, because I want people out there to know that what they can do in their neighborhood, because you're talking
who's showing up
players.
At the table, right? Yeah.
Who are the players?
So you have folks that are coming from in Montgomery County. The Department of Liquor Control is big time. I mean, they control all the liquor, so they're a voice to be had at the table. Right. They got a lot of input. Equally important are the Board of Education, correctional services, law enforcement. Then we have a variety of, I actually represent, you're voted in by the county executive. So I'm what's called a voting member, and then there's a public component. So anyone from the public can show up, but there's voting members as well. that show up there. There's an attorney, there's a doctor there who specializes in addiction. So there's a lot of appropriate voices. There's a former professor from Montgomery College, which is the local public community college there. Get together, collaborate, go over what the current needs are of the county. Then during that, it's a 3-hour meeting, so it goes from some 6 to 9 o'clock. The public part is from 7 to 9.
I mean, now you're talking about what makes up a community: schools, police, local attorneys, doctors. I mean, you're talking about a neighborhood, talking about a community.
Yeah.
Now, you bring them together to talk about one issue, about addictions and about substance abuse. And then you've got county agencies that are paid to provide these services and private agencies that are doing it. But I know you're working with a group that put together an advisory committee. And I want to talk about that because it sounds like it's something that neighborhoods or communities can do anywhere in the country.
Yes.
If they have this little model. So tell me about this advisory council out of Montgomery County, Maryland.
Correct. You're exactly right, Mike. So community councils, committees, they offer the community a platform to really have their voice. And so in Montgomery County, the particular council that I sit on is called the Alcohol and Other Drug Abuse Advisory Council. It's a real long, AODAC is what we call it. And so we serve to the delight of the county executive, and we advise on all things surrounding prevention, treatment, access to treatment. And we try to, of course, have a vision of having Montgomery County be drug-free. We keep our finger really on the pulse of what's going on. A lot of what we go over are stats from the previous month or possibly the last year. Depends on how those are being gathered or compiled to understand where the county's headed and what direction, where are the gaps in services, how do we fulfill certain needs.
So you can really deal with these issues in a community where you don't have to worry about, well, you go meet with them and then come back, because this is a crisis. This is an epidemic.
Right.
We need to deal with this, and we need those players to play their role.
And by having those players at the table with all the different voices and input, it's not some sort of binary, outlook and input on where we need to head. One of the finer accomplishments we made recently in the last year was to advocate for a new Avery Road Treatment Center. Avery Road Treatment Center is a well-known treatment center there in Montgomery County. It serves those who don't have insurance and those who have state insurance, and there's a small allocation for private beds. When I was there in 2009, the one and only time I've been to treatment so far, it needed help then, and that was in 2009. Kind of leaky ceilings and things like that. So Montgomery County built this fabulous animal shelter, millions of dollars, and then the community was up in arms. We got this treatment center that's got like holes in the roof. And so we were instrumental in advocating to the county executive and setting forth some momentum in that, along with this organization called the Tree of Hope organization as well. And so the governor was out there, the former county executive, Ike Leggett, was there in a groundbreaking ceremony last fall, and a new state-of-the-art facility is on the way, and we're really proud of that.
Yeah. If you know somebody that has a problem, please call, get them help. Amatus Health is a great program. They're available. And if they're not in your area, call them anyway. They'll hook you up with a program that's close to you.
If you or someone you know is struggling with addiction, reach out to us. We are available 24 hours a day. Visit us online at amatusrecoverycenters.com or call anytime at 833-754-9297.